So welcome everyone. Good morning, good afternoon, and welcome to today's webinar on youth engagement. And this is part of the series of thematic discussions in this occasion it's organized hand in hand with the World Federation Against Drugs, the WFAD, and Association Proyecto Hombre and the Declaration of Oviedo Initiative. So my name is Sonia Putashadnev, and I'll be moderating this session on behalf of Association Proyecto Hombre. I'm the youth representative and the Oceania liaison in the Global Task Force of the Declaration of Oviedo. I'm a master's student from the University of Auckland in Aotearoa, New Zealand, and I'm currently based in Australia. So this webinar is entirely youth-led, and today we are honored to host an inspiring panel of youth speakers who are actively driving change in their communities from local to international levels. This event is being held within the margins of World Drug Day, and a central focus of today's discussion will be the Youth Declaration, which you will hear more about from our first two speakers. So I would also like to introduce Cardalyn, who will be the reporter for this webinar. Cardalyn is a passionate youth advocate with a background in youth and student engagement in worldwide matters. And she will be working on a report to be distributed in the coming weeks. So thank you, Cardalyn, so much. And today's webinar will run for 1 hour and 15 minutes. And a few quick housekeeping notes before we begin. So the session will be recorded and will be shared after the event. You're welcome to post comments or questions in the chat at any time, and we'll have a dedicated Q&A segment towards the end of the session if we do have time. And this webinar is being held in English, but has live Spanish interpretation available. So to access the Spanish interpretation, click on the interpretation icon, the globe symbol at the bottom of your Zoom window, and then select Spanish from the list of languages. If you prefer to hear only the interpreter, you can select mute original audio. So your presence here is part of a growing movement to ensure that young people are not only heard, but actively shaping the future in addressing drug-related issues. Thank you again for joining us, and let's begin. I would like to introduce our first two speakers, Cressida DeWitt and Fuhaira Sana. Cressida is the project coordinator and communication manager at the World Federation Against Drugs, overseeing international development projects in countries like the Democratic Republic of Congo, Kenya, India, and Georgia, while serving as the primary contact for WFAD members. She is involved with the WFAD Global Gender Committee and the Youth Network, while leading the core youth group and co-author of preliminary studies and position papers contributing to the organization's research and policy efforts. Fuhaira Sana is in her final year studying a Bachelor of Medicine, Bachelor of Surgery at the Services Institute of Medical Sciences in Pakistan. She is the youth coordinator of the Pakistan Youth Organization. Her aspiration is to work in psychiatry, and she is a member of the working group of the Youth Declaration. Together, they will both be presenting about the Global Youth Declaration, and thank you both very much for being here, and the floor is yours.
Am I audible?
Maybe put your microphone a bit closer to you, then it will be louder.
Now?
Yeah.
Thank you. So, hello everyone. I am very happy to be a part of this webinar, and I am actually very excited and honored to co-present this Global Youth Declaration 2025 with Cressida. We'll be co-presenting this Global Youth Declaration. I'll start with the background, its process, and the 6 recommendations which we have been made from the survey. And Cressida will be sharing all the data analysis of the close-ended questions of our survey. So we'll begin with the background of this Global Youth Declaration. So, and Cressida will be presenting, sharing the screen because it's my first time as a speaker, so I really don't know how to do this. So yes, if we talk about the background of this Global Youth Declaration, so last year, which means that 67th CND, Pakistan Youth Organization, World Federation Against Drug, and Drug Free America Foundation hosted a side event titled Role of Youth Participation for Drug Policy and Drug Prevention. This side event sparked the idea of Global Youth Declaration. And after the 67 CND, under the umbrella of these three organizations, some discussions were being held and a virtual core youth working group was created. If we talk about the process of the Global Youth Declaration, how the process was being made, how the survey was being formulated. So, next slide. Yes, thank you very much. So, a virtual core youth working group was created, and there were 15 members from 13 different countries. Our core youth group began by discussing youth engagement in our respective countries and regions. As our discussions broadened, we decided to conduct a survey to map the youth engagement globally, exploring youth how they want to be involved in drug prevention, treatment, recovery, and policy. We collaborated on developing the survey format, incorporating suggestions from our core members, and refining the questions of the survey through extensive discussions. Then we finalized the survey, disseminated to worldwide with the core members promoting it within their own specific networks, regions, and their countries. We periodically monitored the response, and then with our group approval, we extended the survey deadline twice to encourage the youth participation and to get the maximum response. Following the survey's closure, we initiated the data analysis and shared the draft. Now, basically, a survey consisted of two main parts. There were close-ended questions and there were open-ended questions. The basic reason of the involvement of the open-ended questions was to get an idea about how the youth want themselves to be included, to get an idea about what suggestions, what advice, or what recommendation they give us in this survey. So if we talk about, there were 6 recommendations, there were multiple suggestions and advices given by the youth. So we basically divided it into 6 recommendations or 6 pointers to get an idea about the youth involvement. So we'll briefly discuss each of the recommendations and pointers and what the suggestions in each recommendation. So yes. The first one is actively listen to and involve youth. It means that youth want themselves to be included in program development, policy, and decision-making process at all levels by providing platforms for meaningful youth engagement. So according to our survey, more than 75% of the youth across various age groups express a sense of being misunderstood by their government while reporting limited opportunities to actively engage in processes. So the different things under these recommendations, different solutions and advices include: number 1, establish dedicated spaces for dialogue. Number 2, create democratic and transparent youth councils with regular consultations. Also include youth representatives in policy discussions at all stages of policy formulations. Not only this, organize forums, focus groups, and declarations to amplify youth voices. Next, yes, enhance research and modernize risk awareness campaigns. So there is a need to conduct comprehensive youth-focused and gender-differentiated research and translate findings to modernized, sensitized, evidence-based awareness campaigns. Also, social media and digital platforms should be leveraged as effective outreach tools, complemented by traditional media to actively avoid stigmatization. Our survey results highlights a significant disparities in risk perception and substance preferences across different age groups. Special attention should be paid under the age of 18 years. Next. Implement gender-responsive approaches to address substance use challenges. Youth stressed on the importance of developing gender-sensitive policies and intervention that acknowledge and are tailored to the unique challenges faced by youth of all genders. Survey showed that women under 23 experience higher exposure to substance use and face increased vulnerability to mental health struggles, peer pressure, and economic challenges, while men report increased economic and social challenges at later stages of their lives. Next. Ensure increased provision of improved and accessible youth sensitized services. Now, youth demands accessible, affordable, and sensitized treatment and rehabilitation programs designed for youth to support their sustainable recovery, recognizing the lack of youth services. Suggested services under this recommendation includes increased number of skilled psychologists to avoid long waiting lists, establish 24-hour service team, create accessible telephone hotlines for immediate support and referral. We urge the development of comprehensive reintegration and aftercare services to facilitate youth reintegration. They should be developed in collaboration with youth organizations and emphasize holistic support systems, including family involvement, peer counseling, and community-based programs. Number 5, empower youth through economic independence and leadership opportunities. We underscore the critical need to support youth in achieving financial independence and fostering leadership opportunities as key factors in sustainable prevention and recovery. So, under this recommendation, few advices include to empower youth as change makers. We recommend integrate financial empowerment measures such as vocational trainings, job opportunities into prevention and rehabilitation programs. Establish and support youth-led initiatives including task forces, mentorship programs, and leadership workshops. Provide financial and institutional support for youth organizations to actively engage in advocacy, education, and peer-led interventions. Create accessible youth centers that offer resources, skills, development as safe spaces for youth to support one another. Next, strengthen policy support and policy enforcement. We advocate for expanding community-based programs, understanding the community's role in youth development and fostering understanding and support of youth challenges through awareness-raising campaigns, capacity-building workshops, and destigmatization campaigns. Establishment of consistent enforcement of comprehensive policies, preventing substance use exposure among minors and young adults, restricting the advertisement and prioritizing alternatives to incarceration. These efforts will definitely contribute to create a supportive and healthy environments for young people. Our youth declaration was presented basically to reaffirm our right to be heard, protected, and participate in policies which are affecting us, youth, as outlined in Article 12 and 33 of Convention on the Rights of Child and Sustainable Developmental Goal Target 3.5. Our survey collected data from 64 countries and more than 1100 responses were gained. And the age in this survey was 19 to 25. This was the part of my presentation. At the end, I would just like to say that fight against drug abuse and substance use disorders is a collective effort, and youth must be at the heart of this movement. Let us work together to create spaces where young people's voices are not only heard just as the recipients of information, but as active contributors to the solutions that will make their communities safer and healthier. At the end, I would just like to give special thanks and huge shout out to Presida for presenting this and sharing the screen for helping me out. Thank you so much
Thank
for
you.
listening.
Thank you, Fahira. That was an amazing presentation and very on point, also your call. And I just want to add on to that a little bit. As you shared, basically we had two parts of the survey, and also Fahira shared that it was more of a open-end questions and a closed-end questions, and we had a quantitative as well as a qualitative analysis. And I want to just dive a little bit in the quantitative part, because I believe it's also very important, besides the recommendations that were given by the youth, it's also very important to understand a few developments in order for us to be able to advocate better for youth, but also with youth. So we always want to highlight that it's always with youth is part of the formula in that sense. So as Fahira shared, we got quite a lot of responses. We got over 1,100 responses from 64 countries. This means that we got a little bit more than that, but we did exclude answers that were suspected to be interfered by AI, and this is mainly relevant for the open questions, duplicates, or responses contradicting the youth group's commitment to the Universal Declaration of Human Rights, the Convention on the Rights of the Child, and the SDGs, but also this was very minimal, so an exclusion maybe rate was up to 10 answers. So while the youth declaration is a call for action, this presents the findings, or the data presents findings that should be considered, as I said. So it is important to note that the questions posed in the survey focused mainly on perceptions. We did not, for example, ask about their specific drug use or for ethical reasons, but we rather asked how they perceive their use in their environment. So the first thematic point I want to highlight on is, of course, the gender differences and the perception and use. So as we know, it is essential to understand the existing gender differences, and the survey confirmed as well as revealed new gender differences. So for example, when it comes to exposures, which you can see on this graph, females and males are most exposed to alcohol and tobacco, and significant differences emerge when looking at the specific types of substances encountered. Generally, we see a higher exposure of different substances among males than females, except for vaping. We also see a difference in risk perception. So we do see here that the so-called gender gap is closing. So in this graph, the higher the bar, the lower the perceived risk. So where you can see the perceived risk being lower among men than women, this is especially the case in some regions such as Bangladesh, Cameroon, China, Namibia, Sri Lanka, and Zambia. We do clearly see an exemption of even lower risk perception among youth who did not prefer to share their gender, which needs to be considered in programs, and further investigation is needed for tailored responses and for a better understanding as well. When we look at the perception and use, so we see that the challenges faced by males and females is clearly different as the age progresses, as per our survey. So with females reporting greater challenges related to peer pressure and mental health compared to their male counterpart until the age of 23. After that, we see that the things kind of balance out, with in the end, even the males exceeding the pressures such as economic challenges, lack of access to support systems, and lack of awareness of risks in the later age groups. When we look at age differences, the findings showcase a causal connection between exposure and assessment of risk. So for example, we can see that as age increases, risk perception increases also. So people who are younger perceive less risk of the substances than those who are older. So we also see that younger participants between 15 and 23 reported higher exposure to illicit substances, and older age groups, on the other hand, were more likely to report alcohol, cannabis, tobacco, and vaping as predominant substances. So as you can see, some of the substances that in the younger age groups were mentioned, while not even in the older, not in this particular graph, you can see that, but we have seen that in the younger age groups, some of the substances came around various times, whereas those substances were not at all mentioned in the older age groups. We also see that youth involvement and effectiveness of government and community responses are very much interconnected. Sorry, this is a slide from the last. So as I said, I have to retract a little bit. We see that some of the substances, such as like here, such as LSD and psychedelics and ecstasy, as even cocaine, were much, much higher when it comes for the lower age groups than the higher age groups. So now the youth involvement and effectiveness of government and community responses. So the outcomes also showcase key correlations between perceptions of involvement and the effectiveness of programs and community responses. So communities that which means that communities that actively engage youth in, for example, policy creation, tend to have a more effective response to substance use. Prevention programs in these communities are also perceived more impactful by the youth themselves. When we look at government involvement, we noted that when governments take an active role in substance use prevention and recovery, communities benefit from stronger support systems, including enhanced family and peer support. This suggests that government engagement reinforces community efforts, leading to better overall outcomes. And then when it comes to youth involvement, we see that youth who perceive their community as effectively engaged are more likely to see their own involvement in policy making as meaningful and attainable. So those who view community involvement as ineffective tend to distrust policies and their potential impact. Greater youth participation in policy and advocacy also correlates with an increased perception of risks across most substances except illicit substances, where discussions often encourage debate and deeper engagement with the issue. So overall, the roles of the community, government, and youth are deeply interconnected. When all three are actively engaged, youth feel more supported and are more likely to seek and receive help from families, friends, and the broader community. However, when one actor is disengaged, trust in the entire system declines, weakening the effectiveness of prevention and recovery efforts. So with that, I would like to hand the word back. But before I do, I just want to advise you or encourage you to read more about the Youth Declaration on our website. It has been translated into various languages, such as Urdu, as well as Swahili and Chinese and Arabic. And also we encourage everyone, whether it's youth here in the group or whether it's youth organizations, to reach out to us and help us with creating, expanding this momentum at the moment. So with that, I'll give the word back to you, Sonia.
Thank you so much, Fuhaira and Cressida, for presenting the background overview and empirical outcomes of the Global Youth Declaration. And we added the link to the chat for the attendees who would like to read more about it. And this Youth Declaration is a key example and emphasizes a global call to action and with key recommendations for government, institutions, organizations, and other stakeholders. So thank you again, Cressida and Fuhaira. So our next speaker is Aliou Mutkar Usman. He's a youth leader and a global prevention influencer. He serves as the youth leader of the African Union Youth Forum on Drug Use Prevention, alumnus of the Global Forum for Youth Leaders on Drug Use Prevention, and special assistant to the ISUP Nigeria on Youth. He is a certified trainer on UPC Core Environmental Prevention Specialty Track and doubles as a project intern with the Global Coalition to Address Synthetic Drug Threats. Thank you so much, Aliou, for being here, and the floor is yours.
Thank you very much. Please, am I audible enough? Can you hear me?
Yes, we can hear you well.
All right. Thank you, Sandra, for bringing me on. Good morning, good afternoon, good evening, wherever you're joining us from. I am very excited, to join this very interesting discussion organized by the World Federation Against Drugs, Proyecto Hombre, and the Declaration of Abido. As mentioned, my name is Ali Mukhtar Usman. I'm from Nigeria, and I'm the youth leader of the African Union Youth Forum on Drug Use Prevention. I'm also very happy that I get to meet Husni and Drusilla virtually, and all other new faces that are here today. And I'm also excited to learn from all of our speakers. Without much further ado, looking at the theme of discussion today, how do we harness the potential of young people to help solve the drug-related problems worldwide? This theme, I believe, is timely and existential, looking at the growing youth population, particularly in the continent of Africa. Just last week, during the World Drug Day, the African Youth Forum organized a continental webinar to discuss similar concerns, which I will, of course, be happy to share the outcome of that webinar after this meeting. To be specific, my contribution to today's conversation will point out 5 key solutions, I believe, if we'll be able to address, if we'll be able to consider, will, harness the potential of young people. Looking at the work that we do in Nigeria and Africa, which also I so much believe aligns with the global declaration that has just been explained. So here are the points. And my first point on the recommendations of what we should actually consider in order to harness the potential of young people is to build the capacities of young people. I mean, for us to effectively harness the potential of young people to tackle these issues of drug use, we need to build their capacities through training on evidence-based curriculum. This will not only improve the quality of their advocacy, but ensure that they are doing the right thing. In Nigeria, for example, I started a project in 2020 called Peer Support Prevention Program through ISAB with the support of INL. Proudly, we have trained more than 58, or exact that number, students, particularly on Universal Prevention Curriculum core course, and also trained more than 100 to 240 on Engaging Youth in Prevention Curriculum by Colombo Plan Drug Advisory Program. And on the continental level, the African Union also organized Engaging Youth in Prevention training in 2023 in Lusaka. And of course, last 3 weeks, we had another Engaging Youth in Prevention training in Seychelles. Second point, after we build the capacity of young people, is to give them access to resources. Now, when you give them the education, when you build the capacity, the next step, I believe, is to give them access to resources, both human resources and financial resources. This is very critical, financial resources, because it actually hinders a lot of potential of young people to be harnessed. Example of such was seen during the 2023 Engaging Youth in Prevention curriculum training in Lusaka by African Union. So after the training, we had 66 young people from across the African Union member states who submitted proposal for prevention interventions to be implemented in their community, but due to lack of access to financial resources, that has not been able to materialize. And this is also applicable to the peer support and recovery program we've started in Nigeria. The third point is mentorship. When you give them the education, the capacity, you give them access to resources, continuous mentorship is one aspect of professional development that every young person should have access to, after building their capacities. Mentorship is essential to guide their activities and action. It also serves as a form of checks and balances for professional growth. And this is one key area that was highlighted during our youth forum webinar last week. The fourth point is visibility and recognition. Many young people are working passionately to advocate for drug use prevention, mental health, and other social issues affecting their communities. But that recognition from even local organizations and local communities is not there. And that in many instances actually diminishes the zeal and courage of young people, because of course, young people need to be recognized. The last point, which is the fifth point, critically, is access to opportunities. Young people need to be given access to opportunities for their potential to be effectively harnessed, particularly to address problems of drug use worldwide. Invite them to the negotiating table as stakeholders, because this is an issue which is largely dominant among the youth population. We need to give them access to internship opportunities in drug-related organizations, provide them with programs that enhances their skill, be it sports, art, and the creative industry. That particular set of skills and programs can draw their minds away from drug use to positive community development. Finally, young people need to be included in decision-making as advisors. During our webinar last week, a participant asked a question that when will the African Union establish a youth advisory board on drug-related issues? And of course, I made the same, agitation to UNODC in Vienna last year, that we need to have youth advisory board. We have that for, say, for example, issues related to climate, issues related to trafficking, and other social issues. And even the African CDC has a youth advisory board, but we don't have that which relates to drug use, youth advisory group related to drug use. And I also see publications online for project proposals to be submitted by young people and to be funded on other critical issues. But we actually lack initiative for drug related evidence-based prevention intervention championed by young people. So we need initiatives like that, and I believe if we're able to put all this together, we will effectively harness the potential of young people in tackling drug-related issues worldwide. I thank you all for inviting me to contribute to this conversation, on behalf of all the young people in the African continent. And I look forward to practically implementing some of these discussions that we'll have today and learning from other speakers. Thank you, Chair, and over to you.
Thank you so much, Aliu, for your messages on capacity building, access to sustainable resources, mentoring, increased visibility and recognition, and greater access to opportunities for youth. And we all know that that's very important for youth to be actively involved in addressing drug problems globally. Thank you so much. And now I will introduce our next speaker. So our next speaker is Emily Hill. She is in her second year as the Substance Use Prevention Coordinator at Scott Country Public Health in Minnesota, United States. She specializes in underage substance use prevention, mental well-being promotion, and community collaboration through the leadership of both the Scott County Prevention Coalition and the Scott County Youth Advisory Committee. She holds a bachelor's degree in global health studies and Spanish, as well as a certificate in disability studies, and is currently working towards becoming a certified prevention professional. Thank you so much, Emily, for joining, and the floor is yours.
Thank you, Sonia. Hello, everyone. Again, my name is Emily Hill, and I'm joining here today in the United States in Minnesota. We're like a central northern state here. And I work for that local public health agency in Scott County. Scott County has a population of about 155,000, and we're across 7 cities, 12 townships, and 5 school districts, so a little outside of like a metro area in our state, but still pretty rural with a lot of farm land. And again, my main focus is substance use prevention, and I'm able to do this work via a federal grant, Drug-Free Communities. And that's really well known here in the United States, but essentially this grant funds community coalitions nationwide. And then these coalitions are made up of required sectors that do the work of youth substance use prevention at the local level. So I'm just going to kind of dive in at a local level and just some examples that we have here. So we've had this grant since 2019, and the first 5 years we had youth representatives on our community coalition. But something that we did about 1.5 years ago is we actually developed a youth advisory board, as that was mentioned, at the local level. And so that's why I mentioned those 5 school districts in 7 cities before, is we serve all of these. And we really wanted this youth advisory committee to bring those 5 school districts, those 7 cities, those multiple point of views together, and then serving that community as a whole. So the Scott County Youth Advisory Committee, like I said, it was started in December of 2023. So it's been only 1 full school year and then a half a school year that we've been together, but we meet monthly. And at these meetings, our youth are able then to talk about what's going on at your school, what's going on at your school, like what are you seeing? How is your school dealing with vaping in the bathroom, for example? And so really just getting these youth put together and connected and showing them that they're not alone in their struggle, their school's not alone, and that our community is here and we have the resources and means to get them together and then promote them up so they're able to do the outreach and advocate for themselves. We've done a ton of community outreach. So we'll go around to various events and we'll provide education, we'll connect with parents, we'll connect with other students, do recruitment, and things of that sort. Just really, again, trying to get around to all 7 of our cities. We have youth represented as young as 11 years old in 6th grade, up to 12th graders who are about 17, 18 years old. They've also expressed interest in training. So when they come to me, when they're like, hey, like we had an overdose in our school, can we do an overdose reversal naloxone training? I said, sure. And we got it so that we had a local community organization come in and actually train them all on overdose reversal, provided them all free naloxone, and then they were able to take that again back to their peers And they had a link for if anyone that they talked to were interested, they could go back to that community organization and get trained themselves. We also had like the local hospital come in and do some healthy coping strategy building and things that the youth could use for mental health awareness. And then again, bring that back to their peers. They've also done various projects that they've expressed interest. Their most recent was a student-led listening session. And so just a couple youth from one school district in particular put it together and then hosted it. So they had a wide range of experiences from other peers in their school on what are you guys seeing? How is the school reacting for you guys? How do you feel? Do you feel safe? Do you feel unsafe? What do we need? What can our community do? We have this coalition that we work for. We want to help. We want to do something. And they had that listening session. They gathered input. I helped them connect to the local data. Our state of Minnesota does student surveys, so they get community-wide data on youth substance use, perception of harm, of risk, etc. We put it all together, and these students actually made a plan, and they got someone involved, their chemical health counselor at the school involved, and they started a student-led school club on substance use prevention. And this is something that I wasn't ever really planning on doing, and it's like another branch into now we have this community-wide youth advisory committee, and now some of these students are starting it within their specific school, so they can serve within their school, but then also come back and serve their community. And we're super excited. I mean, they just started it up at the end of this last school year. So they got their leadership board together, they recruited youth, they have a plan for next year. So they'll start up in September, and I'm excited to see where that goes. And then hopefully too, like that will be again a pathway for the other members of the youth advisory committee then to take back to their school. And they have then we can have it in all 5 of our school districts around our community. And then the last one, of course, is just other external opportunities that have come up since I do work for the county government. There's been statewide opportunities where they're able to interact with our statewide legislators and influence policy, discuss their concerns. We've had a federal, so nationwide level, we had our representative for us who sits in Washington, D.C. She came to one of our youth advisory meetings and actually had questions for our youth. And she wanted to know what they were seeing, what their concerns were, and what she could do at the federal level to help and make it the issue better. And then our most recent one that was super exciting is at our local county board meeting. They had a discussion and they invited all the substance use experts in our community from treatment, recovery, harm reduction, prevention. Everyone was there. There was the county attorney, there was police officers, there was directors. So a lot of big name people. And then we were actually able to invite and bring some of our youth advisory committee members. And for the first time, youth voices were recognized as experts in this field in our community. And we were so excited, and it's about time that they get the recognition that they deserve. And I hope that this can continue to grow up and go global as we're here to discuss today as well. And it really does start at the local level. That's all I have time for today. So thank you everyone for listening, and I'll pass it back to you, Sonia.
Thank you so much, Emily, for explaining more about your different programs and the projects that you're part of and how you work with youth in the community and especially with the Scott County Youth Advisory Committee. Thank you so much. So now our next speaker is Drusilla Reinhard Blinker. She is the Director, Youth Leader of the SLH Youth Initiative and Quality Assurance Manager at Loving Hands Foundation in Suriname. Drusilla has a degree in social human studies with a major in psychology at the Atlantic International University. She has presented at CICAD's regular session at the Commission on Narcotic Drugs, attended the Global Youth Forum in Abu Dhabi as a co-trainer, and co-facilitated the second Caribbean Youth Forum on Drug Use Prevention among youth. She is also the SDG Youth Representative in Suriname. Thank you so much, Drusilla, for being here, and the floor is yours.
Thank you very much for the introduction. I am so honored to be able to speak here today, to see so many familiar faces, young people, young leaders that I've met in different countries, different settings. It is always amazing when we come together to make sure that we work towards a sustainable future. So, if we start out today talking about, substance use among youth, we already know that it is an issue, right? We don't have to explain that. I don't have to tell you why it is a big issue. It just is. And the thing is, I'm from Suriname. A lot of people know it as Suriname, but we say Suriname. And the neighborhood that I live in is actually a neighborhood that would be considered one with high crime rates, and also it's very well known for substance use. So usually when I go to the store, or I try to do something, I walk around a little bit, meet a lot of people who are talking about, the situation and what it looks like, and usually complaining about all of the things that are going wrong. But the question that I usually ask is, what are you doing, or what can you do to actually make a change? And that is something that we as young people should really take into consideration whenever we try to speak on certain topics, whenever we try to make sure that our voices are heard. What are we doing to actively make a change? So if we take a look at substance use amongst young people specifically, it affects a lot of the sustainable development goals. If we take a look at SDG 3, that's good health and well-being. If we look at quality education, peace, justice, and strong institutions, it affects all of these things. Because if you have a society where people are using substances, people are not able to go to school, people have healthcare issues. So there's a lot of things that is connected to these sustainable development goals. And for us, it's important. I think my colleagues have stated a few of these also, and why youth engagement matters, because we've concluded, multiple times now that it is important, it does matter, but it's important because young people listen to young people. Usually when you're looking for answers on certain things, you look towards your peers, because that's where you feel free to actually discuss certain things. We could talk about a society within a society, because as young people, we create norms and culture, our own culture amongst ourselves. And it's important to start as early as possible, because making sure that young people get, this information as early as possible, it helps when it comes to prevention. And it's important for young people to build ownership. When you look at young people and you try to explain certain things to them, we do not approach it as something that we try to tell them to do. Don't do drugs, don't do substances. We try to make sure that they get the facts, and that they have that sense of ownership, that sense of leadership. And I feel that that works better in making sure that they consider everything, and they influence their peers in a positive manner. So the role of young people, of course, if we look at policy advocacy, making sure that our voices are heard in policies, when we look at educating young people, creating awareness campaigns, peer-led sessions, social media outreach, there's so many different roles that we as young people have. And it's important that we do look also at digital innovation, because sometimes when I'm online, I get so shocked. I like certain moments. I am very shocked at the creativity and the innovation that is going on in, promoting substances. So I feel like using young people to counter this also is a very important aspect, because we live in this digital environment, and we usually know, the ins and outs better. So it's important to use that as young people. And also making sure that we align everything that we do with the sustainable development goals, because it does intertwine, promoting healthy lifestyles, keeping youth in school, but not just keeping them in school, making sure that they get what they need, that they engage in learning, but also all of the other stuff that they're dealing with when it comes to mental health, care, all of these. In Ting Liefde Volle Handen or Loving Hands Foundation, we do make sure that we have certain sessions in school, but also outside of school to get young people to engage in, life skill sessions that they learn certain skills, something that they can work with, but also giving them information to make sure that they are equipped to deal with certain situations and make healthy and positive decisions. So my time is up, but I'll leave you with a quote that I've been using the past few months, and it's youth engagement or youth involvement in sustainable development is the key to bridging a brighter tomorrow. And it's not just waiting to be involved or included, it's making sure that if you see that you're not being involved, not being included, that you take that leadership role and take those steps towards, contacting the governments, contacting different organizations, so that you, as young people, we, us, I'm young also, but that we are included and involved and that our voices echo as hard as possible. So that's what I want to leave you with today. Thank you.
Thank you so much, Drusilla, for highlighting the importance of the different SDG goals, early prevention, building ownership and leadership, and how your final message on how youth can empower themselves and better mobilize communities. Thank you so much. So moving on to our next speaker, Mohammed Husni. Mohammed Husni is a global prevention influencer recognized as a youth leader at the Youth Forum on Drug Prevention by the Colombo Plan, U.S. State Department, and OAS SICAD since 2019. He serves on the Global Task Force of Drug Free America Foundation and is the 2025 to 2027 International Board Member of the Rotary Action Group on Addiction Prevention, and is one of the two focal points for Sri Lanka in the Declaration of Oviedo. Husni is a co-founder and director of program strategy at Impact Voices, a Sri Lanka-based social innovation intermediary focused on youth development and systems leadership. He also plays a key role as founding trustee and vice chair of inclusion and engagement of the Commonwealth Youth Council, supporting youth engagement across 53 countries. Thank you very much, Mohammed, and the floor is yours.
Thank you, Sonia. So hello, everyone. First of all, I was so happy to see that we have close to 150 participants. So congratulations to all of you. And also thank you for investing your time in this program. Because it means a lot, and we need lots of people investing their time and passionately engaging in this topic to make the change that we are aspiring for. So first of all, thank you so much for investing your time in this particular session. I really hope together we will be able to do something great as a result of these engagements. So when I was thinking what I'm going to say today, I had a number of options, and something I thought maybe I should come up with few things that will be actually helpful for you to take away out of this session. And also that should also be something I felt that something I should be saying that I'm doing in my organization and the programs I'm part of. So it comes with experience as well as it also comes through the practice, which is powerful than just sharing ideas for you to sort of take home. So today I'm going to share three major thoughts or rather insights and call for action with a special focus on prevention, but obviously it's common for many other interventions as well. Because what I realized was most of the time when we talk about most of the time when it comes to these issues, we talk about the need, we talk about the activities and try to answer what should be done. But there's a question, do we really invest our time and reimagine our approach in terms of how are we doing it? So just because you do an activity, does it mean that we see the change, or do we really need to look at how are we doing it and fine tune it so that we'll be able to see better impact? So with that inspiration and the thought process, I'm going to share three things that I thought would be ideal and something that you all can also practice in your organizations, in your community as well. Number one that really bothers me most of the time, because my focus as a systems leadership person as well, people are too busy looking at the systems over looking at symptoms over systems, right? So one of my major observations has been that when it comes to youth engagement in prevention, we are mostly busy treating symptoms than worrying about addressing the systematic issues. In other words, if you often respond, I mean, we often respond to visible problems without addressing the deeper root causes that really keep those problems happening again and again, right? So that is where I think it's important that we also apply positive youth development that has worked out for many of us in this forum, which is an approach that focuses on nurturing the strengths and potential of young people rather than solely addressing their problems, right? Because something I also always believe is prevention is not just a interesting campaign or a slogan. It has to be a culture shift, right? To make that culture shift, we also need to look at things from a systems lens, and our program should also be applied to the positive youth development approach. So that's my first point, and also I also think youth engagement must be part of long-term uh, change strategies rooted in positive youth development. And at the same time, we also need to invest time. How are we going to really engage young people? It is not just purely based on our experience, but also putting that conscious effort to learn the science of engaging with young people is also important. The second major point that I have learned over the years, whether working at community level or in global spaces, is that we can't afford to keep working in silos, right? But when it comes to this, it's not just about young people joining hand with young people, but it's also about working with the generations, right? So my second point is intergenerational co-leadership, and this is something that we really practice here in Sri Lanka with our programs, as well as some of the regional things that we do here. This is also really important to see how we can really come out of the segregated approach. Right now, we see, I mean, at some point, we need that youth space. We need to be youth led. We do all of that. At the same time, we have like some of the things run by adults, but also what is important is while we also have some segregated approaches, we also need to see the integrated approach, and where we promote intergenerational co-leadership, where we have that focus so we can work together on tackling some of the complex issues, where because we need intergenerational co-leadership, not just because youth work, I mean, youth cannot do in their own, but also we need to like respect and acknowledge the experience of the generations, and also the energy of innovation and the passion and the new thinking and the and that all that insights that young people bring to the system. So this need to work together to see prevention efforts become sustainable. I'll also go to the third point, that is on the importance of the looking back and looking forward. Sometimes I feel like we are too busy doing things, what we do. It's important that we time to time take stock. So stock taking is very important, and then we need to learn, unlearn, and relearn as we do programs, because we learn that what works, unlearn outdated assumptions, as well as relearn how to work better together. Because when we do that, it's important that we reflect and learn from the best practices, as well as we will also invest more time on the foresight, new trends, and also see how best we can work together for a better impact. So these are the three top things that I thought. So just to recap, it's about the system, not just symptoms. And then it's also important that we learn into engage young people better in terms of rethinking youth engagement strategies. The second one, the major point is like intergenerational co-leadership. And the third major point is like importance of looking back, looking forward, because then we don't just do activities, but we try to do better. We evolve with our reflections, and most importantly, with our vision and foresight. So finally, I would like to say the future of prevention is not just about doing more. It is about thinking better, being strategic, working together, and most importantly, building systems that really help us thrive forward as communities. Thank you very much.
Thank you very much, Husni, for highlighting the need for cultural shift, long-term change strategies, and how to consciously engage youth at all levels, and also emphasizing the need for intergenerational co-leadership, unlearning and relearning to address drug issues better that is all led by youth. Thank you so much. So now I will go to our last speaker. Kirsty Rancier is the youth focal point for the United Nations Office on Drugs and Crime, the UNODC, and has in-depth experience engaging youth in educational and electoral contexts. As an associate program management officer, she works to mainstream youth activities within the UNODC. Kirsty holds a Master of Arts in Public Policy and Public Administration from Concordia University in Canada, as well as a Bachelor of Management from the University of British Columbia. Thank you so much, Kirsty. The floor is yours.
Hi, Sonia. Hi, everyone. I hope you can hear me. I just want to say thank you so much for allowing me to be here today. And I'm representing the UN Office on Drugs and Crime as the youth focal point for the office. So what does that mean? What do? I get to work on all the things that you're talking about today. How is UNODC more broadly engaging with young people, and what can we do to, improve this engagement more broadly? And so all of your suggestions and inputs have been really insightful, and I agree with many of the things that have been said already. One thing I want to point out is I know many of you maybe have interacted with UNODC in regards to our mandate on addressing the world drug problem. However, we don't just work on drug use prevention and this topic. We also work on illicit trafficking, on countering corruption, on countering terrorism, on crime prevention and criminal justice. And so it's across all of these issues that we see the importance of using intergenerational responses. And kind of what Mohammed was talking about at the end of his intervention, this intergenerational co-leadership is really important. We need young people to address the issues of today, but we also need to work together in an intergenerational approach. I know that this event is on the sidelines of the International Day Against Drug Abuse and Illicit Trafficking. And this year, the theme was on Break the Cycle, which I think is very insightful. Many of the topics and suggestions given today were directly related to this. How can we affect change in our own communities at a local level? What can we do on an individual basis? But also, how does this feed into these global and broader scale interventions, policies, things that are going on more broadly? And so when it comes to drug policy, we do need to make sure that young people are involved. I know a few of you have already mentioned some of the work at the Commission on Narcotic Drugs, the CND. And so we already have a number of initiatives that are ongoing, whether it's the youth participation and ongoing engagement in the development of a new initiative called Friends in Focus, all the way to drug grants for NGOs at a local level to work on drug use prevention more broadly. We are doing a variety of things in different capacities to try and work with you, try to engage you. That being said, we also have some activities that span all of our other mandate areas. And so that's more of my area and what I'm involved with more broadly. So I'd really encourage you to check out some resources that we have on this. And after my intervention, I'll post them in the chat. For example, I heard one of the speakers talk about the need for opportunities. We have a UNODC opportunities page directed for youth, so that way you can go to one place and find different ways to engage. We're also trying to do more things and have a one place to find information. I know that sometimes our websites are not so easy to navigate. And so we have recently launched a UNODC youth overview, providing a really comprehensive picture of what all the activities that we're doing with and for youth. Now, I believe I'm also supposed to provide some closing remarks, so I'm hoping to give a brief summary of some of the things that have already been said, just to bring in together all the different angles. Cressida and Fiorella Sana spoke about the importance of youth policy, and especially about the Global Youth Declaration that was created, and giving some great data on a survey that was conducted as well, including the 60 recommendations to make sure that young people are more actively involved in policy. Aliyu talked about the 5 solutions to harness the potential of young people, and really highlighted the work of youth in Nigeria and Africa more broadly, including on building capacity and having access to opportunities. Emily talked about the importance of grassroots and local community support and outreach, especially for secondary school students. Drusilla brought up the idea of what you can do to make change in your own community, and really what and how young people can take leadership roles in this change. And then Mohammed brought a call for three actions, one on looking at systems rather than symptoms, looking at intergenerational approaches, and then the importance of looking both backwards and forwards when creating and moving forward with policy. I think all of these points really bring together the idea and the understanding that young people, that all of us here are not just wanting to be bystanders in this process, but want to be active participants in policy more broadly. And I hope that we can continue to work together in different capacities to really get this done and make sure that there is more space for young people in these policy areas. So with that, I'm going to hand it back over to Sonia, but thank you. And if you have any questions, happy to support as well.
Thank you so much, Christy, for your closing remarks and also for giving an overview on the UNODC and what the work that you do there. So we do have some time for questions. If I can check the chat box. Yes, some of the participants asked that the presentations be shared, and you can ask the speakers to share some links with more information on each of their sections, and we can distribute that after the webinar. There's a question for Emily. Rebecca would like to know whether you would be able to list some of the recommendations and suggestions that youth asked for.
Related to what aspect? I guess, I mean, really the biggest recommendation and what they've been putting a lot of effort into is getting into their school and what the school is lacking in serving. Again, these are like someone mentioned secondary students, so 6th through 12th grade or 11 through 18-year-olds, and most of their life is in school. And so most recently we've been working in what can our schools bring and how can our schools provide more support, more opportunities for youth to be involved that can help keep them away from substance use. And then what can the schools do when like a lot of kids are vaping and a lot of kids are using and even using within our schools. So what should our school board, our school administrators be doing to support students that are using and support the students who aren't yet using or aren't even using at all? So that's kind of been our biggest focus recently is looking at our schools. Community-wide, more so, like I said, they just have taken it back to the school, but community-wide they've really found the main problem being we do have like a casino in one of our cities. And so a lot of substance use is happening around that casino, and it brings in a lot of outside community members to our community. And then that casino is located right on tribal lands as well. So our tribal youth are at much higher risk as well within our community. And so then now looking into what are some tribal considerations for prevention that we could come up with. So thanks.
Thank you very much for responding to that question. I don't see any more questions in the Q&A box. So I'll make the final closing remarks of this webinar. So just to extend a special thank you to our incredible youth speakers who not only shared their knowledge and ideas and also their experiences, but also their passion, their courage, and your voices are powerful and your leadership is essential to building the future that we all want to see. And today we've explored the different examples, opportunities, and calls to action when young people are genuinely engaged in shaping drug-related policies and responses. We've seen that youth are not just the future, we are also the present. Government, civil society, education institutions, healthcare providers, law enforcement, the private sector, and community leaders must all work together and be guided by the voices and leadership of youth. As youth, we have the right to be heard, to be included in decision making, and to drive solutions that affect our lives, whether through advocacy, education, peer support, creativity, or direct action. We have the power to spark change. On behalf of the organizers, we want to thank each and every one of you for being here and for being part of this movement and for reminding us that when youth lead, progress follows. Let's keep the momentum going, and thank you all very much, and we hope to see you all again soon. Thank you.